Hello everyone. So this is third class of genetics, that is prenatal diagnosis, effects of drugs, radiation and chemicals on prenatal development. So what is prenatal diagnosis? It includes the procedure undertaken to diagnose genetic abnormalities, structure anomalies in early embryonic or fetal stage for timely prenatal counseling and appropriate interventions, allow timely termination of pregnancy, prevent wastage and perinatal mortality. Now, if you see, the genetic and environmental factors have influence on various stages of development in zygote, pre-embryo, embryo, fetus, and even in neonates. So, there is fertilization, there is pre-embryonic stage, which includes zygote and blastocyst up to 2 weeks, then embryonic period, which is from 3rd to 8th week, and fetal period, which is from 9th week until the end of pregnancy. Prenatal diagnosis focus on diagnosis of various birth defects. Who are at risk couple? Okay, so those who are having different reason which can put them on the risk of having any kind of genetic abnormality. Okay, so at risk couple can make informed choice about continuation or termination of pregnancy if a serious abnormality is detected, or think about early effective management to improve quality of life for their child. With normal test result, at risk couple can be reassured. Indications of prenatal testing. So first one is advanced maternal age. It is associated with increased incidence of Down syndrome. Other autosomal trisomy is also reported, and cause of chromosomal error can be aging of the egg as ovum suspended in prophase stage. Average advanced maternal age is 35 years or more than that. Most women at this age are offered amniocentesis or CVS, that is chorionic villus sampling. Previous child with a chromosomal disorder, that is also an indication. So history of chromosomal disorder in previous child, increased recurrent risk for chromosomal disorder in next pregnancy, increased risk if either of the partner have balanced chromosomal rearrangement. So here is the image of child with Down syndrome where the karyotype is also shown, and here it is shown trisomy 21. Family history of chromosomal disorder also need for prenatal diagnosis depend on type of chromosomal rearrangement in the index case. Index case means the first diagnosed case. Okay, karyotype of couple determine their recurrence risk. Okay, this is pedigree chart you are able to see. History of single gene disorder in previous child or family. Attempt should be made to establish a diagnosis in an index case to provide active management of affected child for prenatal planning of future pregnancy. Then what is positive triplet test? Estimation of serum alpha fetoprotein, beta HCG and serum estriol. So these three, AFP, beta HCG and serum estriol level in maternal serum, low AFP, high beta HCG, low estriol, they are increased risk for fetal aneuploidy, especially Down syndrome. High alpha fetoprotein can be seen in open neural tube defect and certain gastrointestinal tract anomalies. With a positive triple test, fetal chromosomal study is needed. A good ultrasound anomaly can scan, confirm an anomaly. Abnormally USG, soft marker for chromosomal syndrome, also an indication for prenatal diagnosis. Many chromosomal abnormalities have morphological abnormalities, can be picked up on ultrasound. Confirmation of syndrome in affected pregnancy help in deciding time, mode of delivery and therapy. and accurate genetic counseling can be offered on a confirmed diagnosis. Then infertility also needs prenatal diagnosis. Infertile couple on assisted reproductive programs have chromosomal rearrangement as a cause of infertility at increased risk for a birth defect in pregnancy if achieved. Okay, prenatal diagnosis can help these couple ensure an ongoing healthy pregnancy, or if there is abnormal, then they can make an informed choice or decision whether to continue or terminate. History of neural tube defect in previous child or family. Neural tube defect inherited as multifactorial disorder. Okay, one chromosome factor are ruled out. Couple with neural tube defect child should be offered maternal serum, AFP screening first and second trimester, ultrasound scan, and it is having 95% success rate in diagnosing maternal illness, maternal genetic disease, and bad obstetric history. Bad obstetric history means there are many fetal losses, or there is history of abortion. So pregnant mother with poorly controlled insulin dependent diabetes or epilepsy are at risk of fetal structural defect, can be due to the disease or due to the drugs used for the treatment. Mother should be counseled or offered fetal ultrasound for detection of possible anomalies. Women with history of repeated fetal loss due to chromosomal defect in product of conception should be offered prenatal cytogenetic evaluation. So what are the different indication for prenatal testing? Okay, as I mentioned, first one is advanced maternal age, previous child with chromosomal disorder, family history of chromosomal disorder, history of single gene disorder in previous child or family, positive triple test, abnormal ultrasound finding, soft marker for chromosomal syndrome, infertility, history of neural tube defect in previous child or family, maternal illness, maternal genetic disorder, and bad obstetric history. Now, what are the techniques used in the prenatal diagnosis? Current technique which are involved in prenatal diagnosis: maternal serum screening, the triple test, ultrasound evaluation, fetal tissue sampling, and laboratory genetic test. Other advanced techniques include FISH, that is fluorescent in situ hybridization, pre-implantation genetic diagnosis, analysis of circulating fetal cells in maternal blood. Counseling and informed consent. Before prenatal diagnosis, couples needs to be counseled, should elicit a detailed clinical and family history, should confirm indication for requested diagnosis. Patient should know the laboratory test performed as pre-indication only, as per indication only. Safety and efficacy of obstetric and laboratory test should be explained. Okay, couple should be informed about possibility of need for second sample in case of culture failure or ambiguous results. Informed written consent should be obtained from all the patient before procedures. Physicians or geneticists required to obtain a license from respective state government as per the act. The act, that is Prenatal Diagnostic Technique Regulation and Prevention of Misuse Act 1994, amended as Preconception and Prenatal Diagnostic Techniques Prohibition of Sex Selection Act 2003. This might be asked in your MCQ. Now, prenatal screening. So screening procedure are simple, cheap, these are least invasive, these are safe and easily repeatable. So screening procedures, first is history, where you are asking whether there is increasing maternal age, there is congenital anomalies in previous children, or family history of stillbirth, recurrent first trimester abortion, or cousin marriage, that is consanguineous marriage. Second one is feature of current pregnancy, where there is history of drug intake, for example anti-epileptics, warfarin, alcohol, smoking, radiation exposure, maternal chronic disease such as diabetes mellitus, cardiac, renal diseases, uterine fundus large or small for the date, decreased fetal movements, fetal malpresentation, viral infection in early pregnancy. These are also screening procedure. Then there is ultrasonography, screening tool in all the 3 trimester it can be used. At 10 to 14 weeks, if fetal nuchal translucency is more than 2.5 millimeter, chromosomal anomalies are present. At 18 to 20 weeks, 75% of fetal abnormalities can be diagnosed using the ultrasound. Okay, you can see here the level of maternal serum alpha fetoprotein. So in case of unaffected, this will be the level. In open spina bifida, level will be still lesser, and in anencephaly there will be still lesser level of the maternal serum AFP. Okay, in case of Down syndrome, also the MS AFP level will be less, and also the serum estriol level will be less. So what is quadruple test? It includes triple test plus inhibin A estimation. This test plus maternal age detects 76% of Down syndrome. Okay, triple test, you know what was there. Triple test, we were measuring. There was beta HCG, there was serum alpha fetoprotein, and there was serum estriol. And if along with that you are adding inhibin A, that becomes quadruple test. Double test. So double test, low pregnancy associated with plasma protein A, that is PAP A level, and raised serum beta HCG during first trimester. So double test plus maternal age diagnose 60% of Down syndrome. You can see here serum estriol level. In Down syndrome the level is reduced, and in case of same Down syndrome, the serum HCG level is also reduced. So you can see here, this is the chart. Down syndrome, AFP is reduced, beta HCG increase, serum estriol level is reduced. In trisomy 18, AFP is reduced, HCG is reduced, and serum estriol is also reduced. In spina bifida, AFP level will be increased more than the normal, but HCG and serum estriol level will be normal. So all these are different conditions where you will be seeing the level of triple marker. Then ultrasonography screening tool, this I have already explained. It can be done in all the 3 trimester. Now obstetric ultrasound can be used for detection of structural anomalies of fetus, and also ultrasound is used for needle guidance in various invasive procedure where you are taking samples. Okay, so many chromosomal defects have some ultrasound markers known as soft marker. If such markers observed, amniocentesis or fetal blood sampling should be considered for confirmation of chromosomal syndrome. Okay, so first you have to do this ultrasound. If you are able to see some soft marker, then you can go for amniocentesis or fetal blood sampling. Amniocentesis means you are going to take the amniotic fluid and do the culture of the same, and you are going to see under the microscope. And fetal blood sampling is taking the fetal blood. So here, when you are seeing the first trimester ultrasound, so you can see neural tube ultrasound, and here this is the neural tube. Okay, and cleft lip and cleft palate you can see here. Okay, so this is the soft marker. Okay, you can see here the developing vertebral column, this is the neck, developing head is there, this is the chest. So here is the cleft lip and palate. Then you can see here ventriculomegaly. Okay, so ventricle is increased in the size, ventricle here. Okay, so this is known as ventriculomegaly. Ventricle means the ventricle present in the brain. Okay, there is lateral ventricle, there is third ventricle, there is fourth ventricle. Here you can see posterior urethral wall anomalies. Here you can see multicystic dysplastic kidney. Okay, so this is the soft marker for multicystic dysplastic kidney. And so here, what are the different soft marker in different syndromes? In trisomy 21, there can be thickened nuchal fold, there can be VSD, there can be double bubble sign, which indicate the dural atresia, there can be short femur. In trisomy 18, remember Edwards syndrome, there can be choroid plexus cyst, there can be ASD, omphalocele, club foot, clenched hand, overlapping fingers. In trisomy 13, there can be holoprosencephaly and facial cleft. There can be ASD, omphalocele, polycystic kidney, polydactyly. In triploides, there can be IUGR. What is IUGR? Intrauterine growth retardation, VSD, ASD, oligohydramnias. There can be multicystic kidney, anomalies of hand and feet, and 45X, that is Turner syndrome. There can be cystic hygroma, there can be hydrops fetalis, there can be lymphedema. Okay, now laboratory techniques. So based on the nature of the underlying or expected defect, there are three types of tests. It can be cytogenetic, where you are going to see the chromosome. It can be biochemical, where you are going to see the enzymes. There can be molecular, where you have to do the testing of the DNA. Aim is to provide rapid and reliable results. Now fetal chromosomal studies, you already know all these indications. So either increased maternal age, positive triple test, previous child with chromosomal anomalies, pregnancy where one parent has a balanced structural chromosomal rearrangement to confirm fetal gender in X-linked condition. Then there is interface cytogenetics. Here you are using fish, that is in situ hybridization with non-radioactive labeled crops. Fetal enzyme assay for more than 90 unborn error of metabolism is done, indicated in all high-risk pregnancy. Amniotic fluid cells cultured for 4 to 6 weeks to provide cells for enzyme assay. Can you, here there are so many unborn, I think you would have seen you have read in the biochemistry what are the unborn error of metabolism. Cells from chorionic villi, direct or cultured, are also utilized. Okay, used when enzyme being tested for are expressed in first trimester. Fetal DNA diagnostic. Okay, so here earlier DNA extracted from amniotic cells cultured for 3 to 4 weeks, diagnosis by direct demonstration of the molecular defect or by restriction fragment length polymorphism, that is known as RFLP. But currently there is chorionic villus sampling is preferred technique for obtaining fetal tissue for DNA analysis. There is no need for culture and test performed in 9 to 11 weeks. So they will ask you in MCQ when you will write your NEET PG, what is the time when you will do the chorionic villus sampling, that is CVS. It has to be 9 to 11 weeks. Then fetal tissue sampling. Okay, so here amniotic fluid studies, that is known as amniocentesis. So here ultrasound guided outpatient procedure is done. You are taking the amniotic fluid. It is having low risk, 0.5 to 1% of miscarriages, ideally performed between 15 to 17 weeks. Again an MCQ question. Complete ultrasound of gravid uterus for number of fetus and fetal viability first should be done. Estimation of fetal weight should be done by fetal biometry, and placental localization should be done, so that you should not do any damage to the fetus. Can be done as early as 11 to 14 weeks. This is the ideal time, but it can be done, and then it is known as early amniocentesis. Not used routinely because of increased risk of miscarriages and poor culture. Chorionic villus sampling. Here the cells from chorionic villi used for biochemical analysis, DNA analysis and karyotyping, and here chorion frondosome or future placenta selected for aspiration. It is simple technique, ultrasound guided outpatient procedure. Ideal time you know already, 9 to 11 weeks. And there are two routes. It can be abdominal route or transcervical route. So you can see the abdominal route, you can see the transcervical route. What are the complications? Complication can be limb reduction, okay, defects, complication of CVS, okay, that is chorionic villus sampling. What are the advantage? Diagnosis is possible in first trimester itself, 9 to 11 weeks. Cells are rapidly dividing, so they are suitable for chromosomal analysis. Sufficient fetal material can be taken as a small sample. Results can be given in a day or even in hours. Simple obstetric technique does not require penetration of peritoneum or amniotic sac. If termination needed, can be carried out in early stages of pregnancy. Then third one is fetal blood sampling. So we started with amniocentesis, then there was chorionic villus sampling, and third one is fetal blood sampling. So here preferred test for rapid fetal karyotyping in advanced pregnancy for confirmation of mosaicism observed in amniotic fluid cells or chorionic villi. Also used for evaluation of fetal hemoglobin hematological disorder, sickle cell anemia. Okay, example. Then it can be for DNA diagnosis or treatment of fetal anemia by transfusion. So this is known as fetal blood sampling or chordocentesis. It is done as 18 to 20 weeks or later. Again MCQ question. Under ultrasound guidance, following should be confirmed before sampling: fetal viability, placental localization, and umbilical cord insertion. Then there is fetoscopy. It is endoscopic visualization of fetus. Optimum time is 18 to 20 weeks of gestation. Only a limited field of view is possible, and entire fetal visualization is not predictable. Procedure carries a fetal gross rate of approx 3%. There can be fetal skin biopsy used for diagnosis of some serious skin disorder, and skin biopsy taken via fetoscope. Fetal liver biopsy is done for diagnosis of some metabolic disorder. I hope you remember those all those storage diseases, Gaucher disease or some other diseases are there. What are the newer techniques? So first one is PGD, that is pre-implantation genetic diagnosis. Advantage: pregnancy is screened before implantation. No physical or mental stress of termination in case of abnormal result. Initially, Y specific sequence was amplified by using PCR, that is polymerase chain reaction. First successful pre-implantation genetic diagnosis was done for cystic fibrosis and Tay-Sachs disease. And what are other technique of biopsy? It can be polar body biopsy, cleavage stage biopsy, blastocyst biopsy, or uterine lavage. What are the effect of drugs, radiation, and chemicals on prenatal development? So definition of teratogen: any chemical or that is a drug, infection, physical condition or deficiency which on fetal exposure cause alteration in fetal morphology or subsequent function, that is known as teratogen. What are the cause of congenital anomalies? Multifactorial or unknown in 70% cases, genetic in 20% cases, environmental in 10%. Environmental example, for example, in hilly areas there is iodine deficiency, intrauterine infection, maternal metabolic disorder, drugs and chemicals, ionizing radiation. Okay, factors determining effect of teratogen: development stage. If it is pre-differentiation stage, that is 0 to 7 days of gestation. If any factor which is involved as a teratogen, so how it can affect the different developmental stage? So if it is affecting during the pre-differentiation stage, that is 0 to 7 days of gestation, there can be death or there can be no effect. In differentiation stage, 7 to 57 days of gestation, there can be malformation. And post differentiation stage, after 57 days of gestation, there can be functional defect, there can be growth retardation. Okay, genetic susceptibility, there can be different species, there will be different effect of the teratogen, and in particular individual there can be different effect of the teratogen. Route and length of administration of teratogen. Okay, so for example, some drug is there as a teratogen, whether it is given by the nasal route or it is oral route or by injectable route, so the effect will be different. Effect of teratogen: immediate effect will be death and abortion. At birth there can be malformation or functional defect, and delayed effect can be carcinogenesis or mutagenesis. Now what are the different drugs? So category A, where the control studies fail to find a risk to fetus. So prenatal vitamin, usually prenatal vitamins are usually comes in category A. Category B, where animal study have not demonstrated a fetal risk but no controlled studies in human is done. Example: penicillin, terbutaline, antacid, prednisolone, insulin, ampicillin. Category C, these are the drugs where animal study showed teratogenic effect but no human study is done. Should be administered only if benefits are more than the potential harm. So for example, furosemide, rifampicin, beta blocker, phenothiazine, methyl dopa, nifedipine, heparin, gentamicin, chloroquine, acyclovir. So these are the different categories. So category A can be given, okay, to the pregnant ladies, but the remaining two, it has to be checked and then only it can be given. Okay, now category C. So category C, animals shown the studies show the teratogenic effect, but no human effect studies was done. And then I have already explained, for these all administered if benefits are more than the potential fetal harm. What is category D? There is evidence of fetal risk in humans. Benefit may outweigh the risk given only in the serious disease, because there is no alternative. If there is no alternative of that particular drug, if you have to give to some pregnant ladies this particular drug, so you can, then only you can give if there is serious disease and there is no alternative to that particular drug, that is phenytoin, valproic acid, diazepam, captopril, thiazide, spironolactone, chlorpropamide, progestin, tetracycline, streptomycin, quinine, methotrexate, vinblastine, azathioprine. And then there is category X, where there is clear human risk that outweighed the benefit. That is, human risk is much more than the benefit it is going to provide. These drugs are contraindicated. So in MCQ, they will ask you which category drug is completely, absolutely contraindicated. So that is category X. Examples: estrogen, androgen, aminoprotein, aminopterin, isoretinoin, thalidomide. Okay. Effect of alcohol consumption in the pregnancy. There is increased rate of abortion and stillbirth. There can be fetal alcohol syndrome, which consists of mental retardation, IUGR, abnormal faces, ocular joint and cardiac anomalies. Effect of cigarette smoking on pregnancy. There can be late abortion, accidental hemorrhage, preterm labor, PROM, that is premature rupture of membrane. IUGR I have already explained, neural tube defect, and long-term defect can be physical and mental retardation. Vaccination. Effect of vaccination on pregnancy. So active vaccination, immunization like live vaccine should be avoided. For example, rubella vaccine should be avoided during pregnancy and 3 months before pregnancy. This can be asked in MCQ. Killed vaccine, for example, cholera, typhoid, polio vaccine given only when traveling to an endemic area. New rabies vaccine does not cross the placenta, so it can be given. Toxoid, they are not contradiction. Toxoid like tetanus. Passive immunization, no contradiction to the pregnancy. Ionizing radiation, they also have effect on the pregnancy. So less than 5 rads and probably less than 10 rads can have adverse fetal effect. Very less chances are there, okay, but 10 to 25 rads, some adverse fetal effect may occur, and more than 25 rads. Rads is the unit of radiation, okay. So more than 25 rads, there can be classical fetal effect, IUGR, structural malformation, fetal resorption. Elective abortion should be offered as an option. Then what are the chemical? If there is continuous exposure to lead, okay, which can lead to abortion from embryotoxicity or IUGR, organic mercury, which can lead to neurological damage, blindness, deafness, or polychlorinated biphenyls, it can lead to IUGR, pigmented gums and nails, skull calcification, or herbicides can cause congenital malformation. So thank you. This is the today's topic. Okay.